Hi, everyone, and welcome to our webinar this evening. Thank you for joining us. Our webinar is a day in the life of an SMS clinic. My name is Allison Stepanok, and I'm a PRISMS board member and an SMS mom. This webinar is brought to you by PRISMS. PRISMS is an acronym for Parents and Researchers Interested in Smith-Magenis Syndrome. PRISMS is an advocacy, education, and support organization for individuals with SMS, their families, and the professionals who serve them. A recording of this webinar and all past webinars can be found on prisms.org under the Education tab. If you have any questions for our speaker this evening, you can type them into the Q&A section at the bottom of your screen. And then at the end of the presentation, we'll take some time to answer as many questions as we can, although we might not get to all of them. Tonight, we will be talking to Barbara Haas-Givler and Madeline Williamson from Geisinger-SMS Clinic in Lewisburg, Pennsylvania. They are here to help us get a better understanding of how one SMS clinic operates, their approaches to patient care and consultations with treatment specialists, and how they develop a plan of care for each patient. Barbara is a board-certified behavior analyst and the Director of Education and Behavioral Outreach at Geisinger's Autism Developmental Medicine Institute in Lewisburg, Pennsylvania. She has extensive experience in special education, serving in many different capacities over the course of her career, including classroom teacher, administrator, educational consultant, behavioral analyst, and research associate for clinical pharmaceutical trials. She has been a PRISMS advisory board member for many years and frequently presents at PRISMS conferences, as well as provides consultations and trainings on strategies to support students with SMS and genetic syndromes. She has co-authored several publications on topics related to genetic syndromes, including frequently cited publications on the educational and behavioral manifestations of Smith-Magenis syndrome. Madeline is a licensed and certified genetic counselor specializing in neurogenetics. She graduated from the Genetic Counseling Training Program at Case Western Reserve University in 2019 with her Master's of Science. She is currently employed as the sole adult neurogenetic counselor at Geisinger Medical Center. Since 2020, she has acted as the coordinator of the Smith-Magenis Clinic at Geisinger Autism Developmental Medicine Institute. So welcome, Barbara and Madeline. Thank you so much for joining us this evening and putting together this presentation. I know if a family hasn't had a chance to make it to an SMS clinic, they probably have lots of questions about how things work and what they can expect out of a visit. So we really appreciate you guys for putting this together and presenting this information for us tonight. And so I'm excited to turn it over to you now.
Hi, thank you for the welcome, and I'm excited to be here this evening. Tonight we're going to be talking about Geisinger's, we call ourselves ADMI, Autism and Developmental Medicine Institute here in Lewisburg, PA. We established the Smith-Magenis Clinic in 2014, and we were the first Smith-Magenis clinic, but we're now happy to say we're one of 6 clinics across the country and members of the clinic consortium. We really do want to have clinics close to, families so they don't have to travel that much. But we also kind of try to reach out to find areas where we can develop our relationships to have more clinics. Each of the clinics are different in terms of the services they have and the resources. But all of us aim to have, either if we don't have the services present, when we try to really collaborate and have other resources for our families. Not okay. So there was Maddie and I were very happy to be at the Smith-Magenis conference down in Texas. So we had fortunate Rick Guidotti took our picture. That brings the smiles for us. This is our ADMI. On the left is the Geisinger-Bucknell Center in Lewisburg, PA. We opened this clinic in April of 2013. It's under the auspices of Geisinger, but we are a standalone clinic here in Lewisburg. Then 2 years later, we established another center, and we're really trying to develop that as almost like a sistership. So we have more locations where families can come to for clinics. This is a map and shows you kind of where our clinic is, and you see that arrow. And once a year, we have a lot of traffic because for the Williamson for the Little League baseball series. So if as members of our clinic, we have neurodevelopmental pediatricians, we have physician's assistants, certified registered nurse practitioner, genetic counselors, behavior analyst, speech and language pathologist, pediatric psychologist, neurology, sleep specialist. We have a phlebotomist, a nurse, and medical assistant. We started very small, and now we have grown our clinic to have quite a number of members. We do see other students other than children with Smith-Magenis on a weekly basis for diagnostic and treatment. So we see patients with Smith-Magenis throughout the year, but we have 3 dedicated SMS clinic days, and each year we have them January, April, and September. Our patients have ranged from 2 years of age through adulthood. We generally are seeing more children than adults, but we have seen some of our children aging into adulthood as well. We've seen patients from Pennsylvania, New York, New Jersey, Kentucky, Ohio, Oregon, Tennessee, West Virginia, New Hampshire, and Massachusetts. So I keep meeting a mom from Hawaii at the conferences, and I keep saying aloha. Well, I would gladly like to do some consults in Hawaii. So, and she always teases me. Maddie, if you'd like to take over here from the initial contact.
Yeah, so we get our patients from a variety of sources. So as far as that initial contact goes, we could get kind of a cold call or an email from a parent or caregiver of someone with SMS. Sometimes we will get referrals from other medical providers. And then sometimes people find us via referrals from prisons. And so once we get that initial contact, what do kind of those first steps look like in getting established with the SMS clinic at Geisinger? So the first thing we need to do is get all of the necessary information to set up a chart in our medical record system. So that's typically, names, dates of birth, contact information, parents' names, all those sorts of things, just so we can get somebody set up. And then kind of the next step is to get insurance information on file, so we can start looking into that in terms of possibly setting up a visit to our clinic. And also within that first step, we want to make sure we get a copy of the genetic laboratory report, just to confirm that we're all on the same page, that, what we're looking at is really SMS and it's not something else that might be served better at a different clinic. So that's the first step in making sure that people are in the right place and getting them all set up. And then after we kind of have that first contact step done and we've confirmed that, this is SMS, we provide information for the family on our clinic and all of our information to provide to an insurance provider, so that families can check and see, what they can expect to be covered, if we're out of network, if they need any other referrals, those sorts of things, to make sure everything runs smoothly when you're getting set up for your first appointment. And then once we kind of get all that squared away, or we're working on all of that, we mail out intake packets for all of our new patients. So not just for SMS Clinic, but for any new patient coming to ADMI, we'll get this new patient packet, and it contains several surveys for families to fill out with developmental scoring and other types of things. We send that out a few months before the appointment, so that there's plenty of time for it to get to families through the mail, have them fill it out, and send it back to us before that first appointment.
To piggyback on that too, sometimes we do have patients coming from out of state or whose insurance are not in network at first, but sometimes we will work together to provide information about Smith-Magenis and why the patient would be, why they should come to see us at the Smith-Magenis Clinic. So we've been able to lobby for that for the families as well.
And then kind of continuing on what are all those first steps leading to that first appointment. So we typically have new patients meet with one of our neurodevelopmental pediatrics providers. That's usually one of our MDs. And it's really helpful for them to have as much current medical information as possible. So PCP notes, other specialists that someone is seeing can all be mailed, forwarded to us, or brought to the appointment. And then on the flip side, when people are meeting with Barbara, it's always helpful to email or bring to that appointment any documentation about IEPs, behavior plans, and any current testing from therapists, schools, or agencies to kind of get all the background there. And then while we're scheduling for a particular clinic, we'll have a conversation regarding the menu of providers that we have available for the clinic and what the family's needs or wants are to kind of curate who are the most important people to see either at that first appointment or, at any given appointment. And then just a note, as Barb said, we do see people from all over. For out-of-state patients, those do have to be in-person visits in Lewisburg, Pennsylvania, just because, because of licensure laws for our providers, we're not allowed to do like telemed appointments over state lines. So we do have to have anyone who's out of state be physically in Pennsylvania. And then as far as we know, some people are traveling a great distance to get to these appointments. We do try to help out with that as much as possible. So for instance, there is a hotel, the Country Inn and Suites, just a hop, skip, and a jump away from the clinic, where most families stay when they are staying overnight. And we do have kind of an agreement with them where if families call and make a reservation by phone and mention that they're coming for an ADMI appointment, the hotel can provide a discount for those families. And then on top of that, Prisms does offer a travel application that families can get at least a partial reimbursement of some travel costs one time for traveling to an SMS clinic. So that's an application that you typically fill out ahead of the appointment and then bring to the appointment for us to, fill out and confirm that, yes, you attended this appointment, and then you can submit that to Prisms. And then other resources we might provide would be a photo story about what a visit to the clinic might look like for people who don't know what that looks like for the first time. That's something we can provide upon request. And then other resources, we have information about nearby attractions and restaurants in Lewisburg and central Pennsylvania, so that when people are kind of trying to make a trip out of this, there are some fun things for families to do together.
We've had some families that plan to see each other again each year if they're doing an annual visit and become friends through the clinics. In fact, at the Country Inn Suites, oftentimes the parents are there the night before our clinic appointment, and we will ask the parents if they would like to be virtually introduced, with privacy to each other. But oftentimes they say, you didn't need to do anything. I knew the child had Smith-Magenis. She was, in the hallway. I knew it. We just greeted and met each other. So this would be, so like as Maddie was saying, she and I will talk to the parents. Sometimes we set up like a mini, like a Zoom or a Teams meeting to say, what do you want to get out of this appointment? What are your goals? What have you had done? And we really try to, the physicians generally do not want to just do prescribing medications, especially, cross state lines and such like that's very difficult. So oftentimes it might be a conversation back to the prescribing PCP of the family. So often the first, because Smith-Magenis, and especially if they're staying over, we'll often have an early morning appointment at 8 a.m. So, and I said, Maddie could be, work for air traffic after we do these schedules to try to make them match and work for the families. So generally the first visit's about 90 minutes. And then many parents might want to see me to talk about behavior and strategies. That would be after the doctor appointment. Then they might see Maddie for genetic counseling. We've even had some siblings of our patients with Smith-Magenis that want to understand it, and with the parents involved, and depending on the age of the child, Maddie could do some genetic counseling. We did have a young man with Smith-Magenis that asked for himself to meet with Maddie for counseling, so he could understand it. Then we have lunch as long as things hold up without the COVID issue. We generally have a lunch, pizza, salad, and cookies, and provided for the families. And it's like a lunch and learn. Parents can meet each other. Some parents have said it's like having a mini, PRISMS conference, because they can just see and meet each other. Some people have never met another person with Smith-Magenis. So then after lunch, we may then have a speech and language evaluation. Marissa is a speech and language pathologist. She also does what are called AAC evaluations. They're augmentative alternative communication, where she might trial some different techniques and technologies, whether it's a picture exchange system or an iPad with a speech generating device. So that would be another, that would be like a busy first visit. That's why oftentimes I've said they stay over the night before, or some parents will say, I might stay 2 nights, I might need to. Virtual visit, Dr. Anne-Marie Morse is a neurologist and sleep specialist, very interested in our patients with Smith-Magenis. And now she does mostly the virtual visits, so they're not scheduled the same day. And, or she could see them at her clinic for a sleep study, or she has consulted with families back to the family's sleep specialist. So I think that's a good way to go. This could be an alternate first visit, and we think about our patients with Smith-Magenis. So oftentimes, if it's a speech and language AAC evaluation, we might put them on first, because we know most of our people with Smith-Magenis are up and early, ready to go. We've had kids asleep after lunch, and if they're asleep with the doctor's office, Dr. Challman or Myers, it's okay. They'll generally wake up a bit, and sometimes the parents get more conversation and get more consultation during those appointments. That should have been a 90-minute. I gave it made it a 2-hour appointment, and then once again could be with Maddie, and then lunch. And none of these are mandatory. It's just a matter of if people what they really want to get out of the appointment. The return visits can be annual or as needed. If they're in, as I said, we always say this in person for the out-of-state patients. We do really have started in Pennsylvania doing some video visits for return patients for some of the providers. Like a behavior, I do not have to have the patient in the room with me, but if it's with our pediatricians or our mid-level providers, they do need to have the patient in the room for that appointment. Once again, for the return, we schedule, 1 or more providers. Sometimes they'll just come back for speech, or just to see the doctor or the PA. So this could be a return, could just be speech and me. That would be plenty. Here we are, our pizza. We have a nice conference room downstairs. Sometimes I've tried putting up some slides for families, but then it's oftentimes parents are just too interested in talking to each other, and the students and the children will meet each other, which is really fun. Some of the resources we provide, and I didn't put it here, but we do have a telehealth, telemedicine, what do I call it? Translating language line that we use for our families that speak different languages. We really try to connect the families to their local resources, especially even behavioral health. So after I meet the family, I have a family in New York, I might then go on the behavioral BCBA board and look for local behaviorists that might work with the person with Smith-Magenis. That being said, also bringing them on board that I would like you to understand about Smith-Magenis, not just have a person go to a therapist. We really want someone open, connections to another Smith-Magenis clinic. We've had calls that, that we're equidistant from Texas. So, with the parent, we're like, let's figure out which is the closest and which clinic, would work, be the best fit for you, especially if there's going to be return visits. We don't want to have an inordinate amount of travel. We always make sure we have the medical management guidelines. Our physicians and our providers are well aware and keep up to date. Any of the new research that goes about, Maddie is quick to share it right before our clinics. We make sure everybody's up to speed if there's anything going on, whether it's research or if there's an opportunity for surveys on the PRISM's website, we encourage everyone to join the PRISM's registry. We provide the card for them to sign up for the registry for information. We do some research here at our clinic as well, but we'll also look and see if there's any ongoing research for the families to help them connect. So thank you very much. And now I guess we'll go into having some questions.
All right, thank you so much, both of you, for that very informative presentation about how the Geisinger SMS Clinic works. And thank you for all the wonderful work you do with Smith-Magenis syndrome. And so now we do have some time to answer a few questions from our audience. We might not get to all of them, but we will get to as many as we can. But first, I want to introduce you to Jessica Rogers. She has put together a short video about her family's journey with SMS and with PRISMs.
I'm Jessica Rogers, and I am mom to Wyatt, who is age 9 with Smith-Magenis syndrome. Wyatt was diagnosed when he was 10 months old, and we attended our first PRISMs conference a little after he was a year old. PRISMs means so much to our family. Just attending that conference so early on and gaining all the information that we did and making all the connections with the families that are sharing this journey with us is something that's irreplaceable. We look forward to the conference every time it rolls around. It means so much to our family, you know, with SMS being so isolating, just having that connection with other families that are walking the same road as you are is just something that we can't say enough about. So I would say that's why we were most thankful for PRISMs, is just for that conference that hosts everyone, that brings everyone together, and that forms those meaningful connections.
Thank you so much, Jessica, for putting that video together for us and sharing a little bit of your SMS journey with us. And so now we have some time for questions with our speakers. We have a lot tonight, so we will get to all the questions that we can. So let's see. Okay, our first question for this evening is, let's see here. What is our first question? Okay, the first question is, have you worked with any out-of-country patients?
Yes, not necessarily with Smith-Magenis, but we have a patient that comes here from Trinidad. We have another patient coming from Colombia as well, but we have had out-of-country patients. We call it destination medicine. So that's one of the hats that I wear here as well, is to come about with how much the cost would be, like to come up with the menu of what the providers the person wants to see. And then if there's coverage, we have some people that were in military that they might be a reciprocal insurance. One family I talked to from out of the country could go to Roddy's Children, where Gail Reiner is, one of our other clinics, because they had a working relationship with them. But I would come up with, working with Geisinger's Finance, to how much exactly you would be expected to be out of pocket for the visit. But yes, we have had and welcome patients from out of country.
Thanks, that's really great. I didn't know you guys saw people from out of country. That's awesome. Okay, so the next question is, can you speak to how we might know if we could benefit from being seen in your specialty SMS clinic if we've already been seen at a broader institute for developmental disabilities and or autism, for example? I assume one of the benefits is specific familiarity with SMS.
Maddie, you want to do it or you want me?
You can go ahead.
Okay, so yeah, there are some patients that, and it's not that we don't want you to come to our clinic, but we've even said, you know, you look like you're really well cared for. And if that's the case, we'll be there when you need us. I always make sure I give tons of resources that are available on the PRISM's website, like articles that are free for for the parents to utilize. If it's a young child in school, encourage them to, on the Road to Success book, which has been very helpful. PRISM's, has that on their website as well for families. So yeah, I think that the benefit is sometimes is the meeting other families and being in a very personalized feeling of persons that really do understand and get Smith-Magenis. So I think that it's really up to the family, and that's what we have that meeting about. We really enjoy the families. We want to see everybody, but yeah, if you're really well cared for, maybe it's just you don't need to come to us.
Okay, thank you. Okay, the next question that we have is, I would love to hear more about how these clinics can work with and help adult children with SMS, especially as they're getting older and might have slightly different challenges. I live in the Boston area and have been to our local clinic.
I think that we at PRISMs and all of the other families I work with of children as they're aging into adulthood, we do know that this is very challenging. I often do have, I forget how many years I've been working with people with Smith-Magenis until I hear the age of the person that, that's asking about services. I think that that's something that's something that the PRISMs organization, we're really very motivated to try to really develop some resources for our families of adults, because it's, there's hard to find providers that will work, that maybe they know psychiatry, maybe they know GI, but they really don't know a person with neurodevelopmental differences. So I think that we have a road to go to. We do have a handful of adult patients, and when adult patients come in, we, either some of the clinics are more able to work with the adults because of the licensure of the hospital and or the credentials of the physicians, because some of our physicians are not credentialed to work outside of pediatrics. So I think this is a goal. I know we're going to be having, we have meetings with the PAB, the advisory board, and the clinics, that this is something that's a very big goal of PRISMs, to really develop resources to help support adults. Mostly what we try to do is find a good doctor around, or I ask parents, they'll say, oh, I had found a really good psychiatrist and I'm in this area. So then, I'll ask if another parent can reach out to the other parent and talk and say, talk to the psychiatrist. We work with other kids with other genetic syndromes. And years and years ago, it was Smith-Magenis, Fragile X, everybody was in their own silos. Now there's a lot of cross-pollination among the clinics, which is really making us all more powerful, because, I have somebody at Children's Cincinnati that I've referred one of my Smith-Magenis patients to, because they have a clinic there and they have a nice host, a group of providers.
Fantastic. Thank you. Okay, the next question is, what months are the clinics at Geisinger?
Yeah, so we, at least the last few years, have been holding them in January, April, and September, and that's the plan for 2024 as well.
And they're always on Mondays, because we feel that people usually travel and come in on Sunday night. We try to look at the calendar and make sure it's not holidays and not during Little League World Series. I did that one year by mistake for our Fragile X clinic. But like I said, but then people can see and after COVID, we kind of got a little out of our routine of having big clinics. Like there were like 5 to 7, people on a day, because then people started doing video visits. But we're starting to come back around, and it's nice if there's 2 parents of 2-year-olds, they get to meet, they can exchange emails and really share their resources together.
Perfect. Okay, the next question is, what kind of medical management is offered?
So if it's a patient that's if the person comes to us and is already not being prescribed by other physicians and is fairly local, then Dr. Challman or Dr. Myers may take over their medical, their prescribing, but they do not want, nor does any doctor want, too many people prescribing and changing up medications. If there's we have another group of individuals that are very highly seizure active, we oftentimes want the neurologist to be closer to the home, especially when you're working with medication management. So many times, we know that there's no magic bullet medication for people with Smith-Magenis, but our staff have many years of experience working with children and adults. So if anything, if they don't prescribe, they may speak with the family's pediatrician or another neurodevelopmental pediatrician to discuss what the child has been on and where to go next. So we often make sure, so if it's a local patient, we had a young woman come to us through our endocrinology department. She was very overweight, and they tested her and found that she was an RAI1. So she's in endocrinology. Then they also were going to be referring her to other of our providers, but then that would be because she's local to our hospitals and she's a local family. Many of our doctors will talk doctor to doctor, if there's a need to kind of help.
Okay, great. Okay, next question is, you mentioned earlier that there are several clinics in the country. Would you please share the locations of the other clinics?
I will give you the states that they're in. We have California, we have Texas, Illinois, Massachusetts, and DC. And there's a link on the website, and maybe it could be shared out where all the clinics are listed with their contact number. Who's the medical director? Dr. Challman is our medical director. Who the clinic coordinator is, that's Maddie, and who the clinic director is.
Yeah, we will share that. It is on the website as well.
And we know there's a goal. And this is the same goal that Fragile X has and Duke and the Angelman groups have, is really to have close to home clinics for our patients.
Okay, would you ever just do telehealth for medication management, for example? It feels like the medication management is very complex, especially when doctors don't really understand the condition well.
I would say if they came they would need a first visit in person. If this is in the state of Pennsylvania, Pennsylvania is pretty big. We have people coming from, a couple of hours away. But if they're going to stay with the course with the physician, do you know what I'm saying? We have especially for medications like for hyperactivity, ADHD medications, and or if the child doesn't have a host of other medical issues. Some of our kids are borderline diabetic, very obese, difficult to get a blood draw. So the doctors really do work closely to make sure, but they can do and will do it if it's, but we need to have periodic in-person visits. Some medications need blood draws every so often. So it's very much dependent on how complex the medical issues of that person are.
Yeah, I can imagine that could be challenging for sure. Okay, so next question is, would you work with an SMS palliative child?
I would think there would be no reason why not. What do you think, Maddie?
Yeah, I agree. I don't know if it's necessarily something that's come up before, but I agree. I don't see any reason why not.
Okay. All right, and I think that the last question for this evening that we'll have time for is, can our current specialists contact your providers for advice without a physical visit to the clinic?
That's a very big question. It's very difficult if we haven't worked with that patient for a quick phone call. It is oftentimes it's never going to be quick with a person with Smith-Magenis, but I will sometimes, many of the calls are fielded probably by me because more people because it's usually around behavior. So, and then potentially I can link them back to another provider. Some of our other PAB members are medical providers. So they might, like Dr. Carrie Boyd, psychiatrist, may end up being able to be helpful. And Smith, many of our advisory board people are also available. So whether Michelle fields the calls, and then she often fields them to me to see if it's just a brief, discussion about, where to go, where to get resources and such. I hope I answered that one.
All right. Well, it sounds like, or it looks like that's all the time that we have for questions this evening. And thank you both so much for being with us this evening and putting together all this great information about the clinics and how they work. We really appreciate it. And I know our families are going to appreciate kind of a look into how things work and what to expect from clinics. And thank you to all of our attendees this evening. I hope to see you all on future PRISMS webinars. And please make sure to subscribe to our YouTube channel. You can find all of our webinars on the YouTube channel. And if you subscribe, that's a great way to be notified when we post new content. And if you're not already a member of PRISMS, membership is free and it's the best way to stay up to date with all things SMS. So please join PRISMS if you haven't already. PRISMS is a nonprofit organization. All of our programs, including our webinar series, are fully funded by our donors. And a wonderfully generous donor is currently offering a match up to $100,000 to inspire other donors to invest in PRISMS work. So this is an excellent time for you to support PRISMS and the many programs that it provides to the SMS community, like our webinar series, our conferences, our peer-to-peer support, our SMS clinics, the patient registry, and much more. So we invite you to use this QR code or the link to take advantage of this incredible opportunity to match your donation. So this does conclude our webinar for this evening. I hope everyone enjoyed it, and we hope to see you back. And thank you both again, Barbara and Madeline, for being with us, and good night, everyone.